Thanks for having me. Great to be here. And Etsimo is all about data-driven healthcare, which means that we apply artificial intelligence and machine learning on vast amounts of health data. The solution that we produce is available to an API, so it's very easy to integrate into existing systems and to accommodate a multitude of use cases. And the end game for us is a learning health system that is built on data and will help transform or transit the healthcare, the current reactive healthcare, towards a more predictive and preventive one. And of course, to do this, you need three things. You need data and more data, and of course, technology and empathy as well. And the cornerstone in our thinking is that you need to get the care need assessment right, because if you get the care need assessment right, you get the intervention right, and you get the recovery started right the first time. And to be able to get the care need assessment right, we'd like to have access to all available data about the individual or the patient. So not only symptoms, but also health history and trends and tracking data from IoT devices and wearables. And as the consumer or the patient goes from the care need assessment through the intervention towards recovery, they generate data. And we would like to have that data loop back into the system to create a flywheel. And when we have this feedback loop, it's actually possible to run a care need assessment in the background for each new data point. And with the help of that, we can actually predict an individual's future health and identify eventual risks that they might have in their near or long-term future. And if we can predict, we can also try to prevent. So we can give impulses to the consumer to nudge their behavior, to change their evil ways a little bit, so that they are back on the more healthy track. And if you look at the flywheel on the left, to build it, as I mentioned, we need data. So we would like to have data from the past, which would be clinical data, medical history, and also, of course, the social determinants of health, which has a great impact. On top of that, patient-reported symptoms and maybe questionnaires that the patient answers now and then to patch up holes in the data sets, and also, of course, the trend data from the wearables. With this data, we are able to create a very accurate representation of the present state of the patient. And from combining the past with the present, we can build models, for example, how the physical activity or lack thereof will affect the patient's future health. Also, if they have the means to, for example, eat well and take care of themselves. And combining all this, we can build a map of future concerns that we can give impulses again to the consumer or to the consumer's caretaker of things that they could improve to stay healthy in the future too. And if we look at the same picture from an access point of view, as has been said today, most of the data now and even more so in the future is behind the individual's consent. And the rest of the data, the kind of professional data, is scattered in different silos, clinics, hospitals, governmental databases, and so forth. So we have different data and different challenges, and the professional data, this is hopefully not news to you, but it's in silos all over the internet. And also the representation of the same kind of data is not necessarily structured in the same way. So it's not easy to combine the silos. And on top of that, the data is very readable and understandable for humans, but not necessarily for machines. And to make the life of people like me, for example, even a little bit harder, some of the players are not willing to share their data. So if you ask a healthcare provider, can I have my data? They would probably give you 500 pages of patient history in a paper format. So they print it out for you, and that means that you can't easily use it for your own good with other actors, and that's a shame. On top of that, there is, of course, legislation and compliance to build an actionable data asset from the professional data already takes a lot of time and effort. On the individual data side, as has been mentioned today, there needs to be a humongous upside for the consumer to start using whatever you are building, and by using it, collecting data that you can use for their benefit. So, for example, they need to know that their health is in good hand. So not only does the system need to be providing them additional convenience or value otherwise, but they also need to know that it's at least as good as the old manual. They also want to know that their data is secure and that data is used ethically. And on top of that, they want to know that the data isn't shared with anyone else without their explicit consent. And to top it off, of course, on the individual side, there is also legislation and compliance. So this too takes a lot of time. And I've been repeatedly questioning my sanity for going into this altogether. But anyway, the way we have tried to solve this problem between, let's say, usability and privacy is that we have split up the data in sensitive data and non-sensitive data. And individuals' data can be represented as a slice of this pie. So the individual has some data that is sensitive, and in our case, that's encrypted and locked in a way that not even we can read it. So it's only accessible for the consumer or the individual. The other part, the non-sensitive data, is then shared with the rest of the gray mass in the repository, which means that we can take the individual situation and compare it with the situation of patients or individuals in a similar situation, and see what they have done or what has been done to them in a healthcare way, and see the outcomes of that. And by comparing this, we can provide insights to the individual about what they could do or what could be done to improve or sustain their current health. So there is a trade going on. So I share my data, and in exchange for that ethical sharing, I get insights about my future health. And I'm fairly sure that my 5 minutes or 7 minutes are up. So thank you very much for your attention, and back to you, Sarah.